about the March meeting for the Board of Health. If we could all rise and pledge allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So Dr. Simmons is traveling, so my name is Kathy Durr. I'm the vice chair, so I'll be chairing this meeting tonight. And the first thing I want to go over is just a reminder, we're now meeting in person the third Monday of the month at 5:30 in this room, unless there's a Monday holiday that the township celebrates, and then we move it to Tuesday. So it's usually January and February. We'll go with the Tuesday meeting. We usually meet 5:30 to 6:30, unless there's a long topic, but we try to stick to that timeline because there may be public coming in and or a Board of Commissioners meeting after. We do not tonight, so we're good. So that's just a reminder. Having said that, we have a new board member among us that we haven't met live yet, so two. Oh, yeah. Well, we had Julie haven't met live yet. Okay. So this is our first in-person meeting. Julie, why don't you go first and introduce yourself?
There we go. See, I've never been in person. Hi, I'm Julie Kohler. I'm a clinical psychologist. I practice here in Villanova, and I'm happy to be here and to see you all in person.
Oh, hi, I'm Kiki Karianis. I'm one of the Radnor School nurses. I've been a Radnor resident for 26 years, and I'm happy to be here. Thank you for having me.
And then we also have with us our new school board or school district representative that's going to be our liaison between the Board of Health and the school district. So do you want to go ahead and introduce yourself?
Sure. I'm Jenny Lesage. I'm the Director of Student Services at Radnor Township School District. Thank you.
Thank you so much for coming with us on this journey. Thank you. So there were minutes sent around from February 21 and our May emergency meeting. So I know they just went out today. Is there any corrections or additions to either sets of those minutes so we can approve those to move forward? Having heard none, can I get a motion to approve the minutes for both the March emergency meeting and also the February meeting?
I'll motion to approve.
Can I get a second on that?
I'll second.
Okay, so approved. So they will be submitted, approved as submitted. Okay, how about the health office report? Kevin is not here. I think we have, Lisa, were you gonna, somebody over there? Are you Lisa? Lisa, okay. Lisa's going to go ahead and share the health officer's report.
Okay, I have a summary of action items completed during the month of February. First one is food safety inspections are ongoing. Township is utilizing the services of our third-party consultant, Barry Isett and Associates. 4 facilities were inspected. Second item is staff responded to 2 food-related complaints. Staff reviewed 2 new applications for food licenses. Staff coordinated with the Radnor Township Police Department with 1 animal-related incident. Staff met with organizers of an upcoming community event. And the last thing is Township administration is working to coordinate a smooth and successful transition over to the County Health Department. Effective April 2nd, 2022, the Delaware County Health Department will officially begin operations. In part, this will include the issuance of licenses and inspections of all food establishments, temporary food events, mobile food vendors, and public bathing facilities within Radnor Township, as well as all calls and complaints associated with these facilities. At that time, the Township will wind down the use of our third-party inspection firm for these areas.
Thanks, Lisa.
You're welcome.
Any questions from the board members about the transitioning over April 2 to the county level? We'll see how it goes. Fingers all crossed. Some of our old business we were going to cover involves animal health ordinances and road safety in Radnor due to animals, but Joan hasn't arrived, so we'll have to table that to the next meeting, because I don't think we have an update yet from Joan. So Lisa and Alex, you're up next with the student intern projects.
Well, the interns are coming along. They had given us kind of what their plan was for the year, and they have, completed their January, February plans, working on their March plans. And I don't know if you just want to say a word or two. Nothing big.
Yeah, so we have finished our literature review of our project, and we're moving into setting up small surveys to examine student and teacher involvement with our project and get a more personalized view for how our topic affects Radnor in particular. So that's where we're going in the coming months.
And any assistance that you need from any of us, or is it going along smooth enough where you're good to go for presentation in June?
I think it is going on smooth enough. We haven't yet tried to get, something that we wanted to do is look into inventory and see how many headphones were purchased last year for virtual learning. We haven't yet tried to do that, but that may be something that we run into hiccups with, so that might be something we would need help with in the future.
Okay, good. Any questions on the projects? Go ahead, Alex.
This isn't a question. I will just add that due to, COVID kind of coming and going and various scheduling things, that I'm extremely impressed with what the student interns have been able to accomplish.
Yes, it isn't easy, so hang in there. Julie, you're up next if you're ready. Okay.
Hi. So the focus of this presentation is really to kind of get to the core of what I wanted to accomplish, which is what should we add to the Board of Health website, or the Radnor website, I guess under like the Board of Health heading, what would be most relevant. So I'll just start by commenting on areas of significant concern for Radnor Township. So in general, if you look at CDC data, there is, and all of you probably know this if you just read the news, but there has been a significant increase in mood and anxiety disorders across the United States and across all age groups. In the general population, the rate of depression has gone from 8.5% of the U.S. population prior to the pandemic to now 32.8%. Another statistic that I think is relevant based on CDC data is 1 in 10 adults reported either having a mood or anxiety disorder before the pandemic, and now 4 in 10 adults report having anxiety or depressive disorders. So that's really a significant change. There have also been increases in substance use disorders, sleep disorders, reporting of neurological deficits. There has been an increase in eating disorders, and areas of concern in terms of mental health in general, and then probably also in Radnor, would be lack of access to mental health care. It's difficult to find a therapist. Most clinicians are busy. A lot of inpatient and outpatient programs have been remote. And this has been a pretty pervasive problem across the country. And then a lot of people have lost their insurance, or their insurance won't pay for it, which has always been a problem, but more significant now, especially with the financial hardships that people have suffered. the post-acute sequelae of COVID-19. So I'm sure all of you have read about long COVID. But COVID-19, the acute infection can cause a depressive episode or increased anxiety. And those that have had previous history of anxiety and depression can also suffer from a more severe COVID-19 infection. Also, in terms of long COVID, a lot of adults and children have reported neurological difficulties with problems with memory, problems with attention, almost similar to ADHD. And what the field of psychiatry is finding, that actually prescribing drugs that we would typically prescribe to patients with ADHD also that has seemed to help at least some patients with long COVID. Loss of loved ones, so a lot of people are suffering from grief. And then educational, professional losses, financial hardships, and social isolation. All of these factors contribute to a real critical need for accessing mental health care. So what I thought would be important to list on the Radnor website would be local inpatient and residential programs, local intensive outpatient treatment options, local community mental health clinics, private practices, support groups, support hotlines, long COVID clinics, and then also potentially links to state and national supportive hotlines and texting services. So what I think we should include would be first a link to the Radnor School District resources page. So that particular website has a great list of resources, not necessarily all even geared towards students, for students, but also their families. And then the Pennsylvania resources for mental health, to include a link to that too, which would be statewide resources. The Penn Medicine COVID Recovery Clinic, that's, I think, a very good local resource that we have. And then I put 3 different ways to locate a therapist through the Pennsylvania Psychological Association, through PSPP, which is Philadelphia Society for Psychoanalytic Psychology, and through the Philadelphia Psychology Network. On those sites, people can designate if they need to use insurance and, it's potentially get a therapist that specializes in what they might need. Emotional support for aging adults. I put a link to the New Horizons Center, Senior Center. It's right in Narberth, but it's a really great resource, and it's local. The Penn Memory Center, the Penn Sleep Center in Radnor. I put links to 3 different eating disorder treatment centers that are local to us. One's brand new, Mentednido, that's right in Villanova. The Renfrew Center right in Radnor, and then Seeds of Hope, which is local. I think there are a couple different programs in Paoli, and I think there's one in Chester Springs too. I put a link to Penn Psychiatry. And then under alcohol and substance abuse treatment, for alcohol and substance abuse treatment, I put a link to the Penn Medicine Center for Opioid Recovery and Engagement. So that's a CORE. The acronym would be CORE, but it's a really good program for Penn Medicine drug and alcohol addiction treatment, the North Star Treatment Services in King of Prussia, and Sobriety Solutions of Pennsylvania, right in Plymouth Meeting. And then our most local inpatient psychiatric unit is right at Bryn Mawr Hospital, so I put a link to that too. And then I included a national suicide prevention lifeline. And then for immediate crisis support, I put a texting option, online chatting option, and the Trevor Project, specifically for the LGBTQ community. And then nationally, there's like an immediate crisis support number if somebody's in a crisis, emotional crisis due to COVID-19 specifically. and I put that number as well. So, thank you.
Thank you, an extensive list, for sure.
So, I wanted it to be.
So this will be posted on the Radnor Township website, I believe under the Board of Health box. I think that's where we put it.
Yeah.
With a hyperlink to the resources, correct?
Correct.
Correct. So anybody in the township that needs resources, there are plenty here to choose from. Do not hesitate to click on the link and get the help that you need.
Yep.
Any questions from any of the board members?
Well, this isn't a question, but this is more of a comment. Well, first of all, I think this is excellent work that you've done on this. It's, so often finding resources, and especially locally, can really, end up being like a maze of, trying to figure out what's where. And one thing I will put out there is, for any community members who are listening, or as commissioners send out their newsletters, is if community members have links to additional resources, or other board members have links to additional resources, that if they send those in, this is always something that can be updated, as happens with other resource lists that we have for other things on the township website. So I just wanted to also put that out there.
Thank you.
Thanks.
I'm not used to talking in a microphone. Does anyone have
Julie.
any other questions or comments, or you want to add resources right now?
No, that's great. Thank you.
Yeah, sure.
So David was going to give a COVID flu update, but he is not here. So I know from a COVID perspective, we are green within the CDC guidelines. Every Thursday, there's a map that gets updated by county on the CDC website for those states reporting. In fact, I just checked, there was one county in Pennsylvania way up in the northwest that's yellow. But in the whole tri-state area, everything's green. So green, of course, means that masks are optional except where they're required by federal guidelines. Buses, trains, planes are still mask required, healthcare facility, et cetera. So keep an eye on the signs, keep an eye on any COVID updates as far as the CDC guidelines, and it is red, yellow, and green. And there are some states, or some counties that are red within the United States, so it's still happening out there. But we've been lucky in this county at least to keep it at bay. Flu updates, all I know is the flu shots are available. I don't know any flu statistics. Anybody has any information? I haven't heard anything, so.
Yeah, at this point, it doesn't seem like it's a very active flu season.
Okay, well, that's good. So low flu activity. As far as new business, I know we had that special planning meeting for the CBD Kratom site. Does anybody, I know there was a letter that went to the Board of Commissioners, I believe. Does anybody have any updates as to any activity surrounding that action? Go ahead.
Yeah, sure, I can update you. First, I want to thank everybody on the board for having the special meeting to begin with, and for so quickly pulling that just beautiful letter together to give us advice on the Board of Commissioners as to your take on the worries, the concerns, and the potential benefits of both Kratom and the Delta 8-THC. So we're crafted an ordinance which merely restricts Kratom from being sold or distributed within 1,000 feet of a school, a playground, or a daycare center. And we had you had gone over that a little bit in the last meeting. As it turns out, that law means 1,000 feet from the edge of the border of the school, sort of as the crow flies out, so in every direction. So it really is much more area of the township than we had thought when we were looking at it at the special meeting. This location does fall under a restriction. And they have yet to get their permits in for building just the basics yet, so they're not even complete into the township yet. So we have to cross that bridge when we get to it. So that ordinance has been crafted. It was voted on to be looked at out there for a weekend, will be seriously voted on Monday's Board of Commission meeting. So the only other thing I really have is an update, which is unrelated to the Kratom thing, is that we are going to do an interview in the executive session of the Board of Commissioners on Monday for the remaining slot on the Board of Health. So we have a candidate coming in. I believe it's Monday.
Great, thank you.
Sure.
So is there anything else you need from us, or do you have everything that you need?
I think we have everything. For the interview?
For interview, for the Kratom?
Yeah, for
or
the interview, we have the candidate is aware, has already talked to David, and I think Alex as well.
Okay, good.
We have the CV, all of that sort of stuff, and I know the township people are on top of that.
Okay.
The Kratom, the letter was perfect, just sort of gave us the facts and no legislation, which was perfect, because that's our job and shouldn't have to be yours.
Yep.
So I think we're good, thanks.
Okay, good, thank you. Any questions?
So explain again, I think at our presentation, we were looking at like along the sidewalk going between, the school and the building, but instead it's, a radius around
It's
the
a
building?
radius from the outside of the property line.
Okay.
To the very outside, of the playground, of the school, of the daycare center. So it's not as you and I would travel, but more as the crow flies out. Much more area.
Well, I'll just really quickly, since David's not here, thank him for the work he did in drafting that letter.
Okay. Next up, Alex has a public awareness announcement.
Yes, I do. So today is the first day of National LGBTQ Health Awareness Week. It's a week for raising awareness about some different health issues that are present in the LGBTQ community. Just some of the basic ones are higher rates of depression and mental health issues, higher rates of STIs, substance use disorder, heart disease, and also in some cases, less access to care. The National Coalition for LGBTQ Health has put together a couple of webinars around this week, including one which is results of a national survey that they do about the current state of LGBTQ health in the United States. That one I actually just got an email about has been delayed and rescheduled, so that one is TBD. But the other one for anyone who's interested is on March 24th, which is specifically about optimizing PrEP in practice, and that's something that if you are either a young LGBTQ person who is starting to take more control of your personal health, or if you're a parent of a teen or young adult LGBTQ person that you may want to talk to your physician about or encourage your child to talk to their physician about. So that webinar is going to be on March 24th at 1 p.m. and anyone who's interested can sign up at healthlgbt.org/awarenessweek.
Thanks, Alex. Anything else from, does anybody have any other new business we haven't brought up yet? Okay. I don't see any public participation here, so if we have no further business, we will adjourn. April 18th will be our next meeting here on site at 5:30. And we'll adjourn at 6:02. Thank you, guys.